The idea of, oxygen therapy, oxygenation therapy, developed in Germany in the 1940s, although oxygen was first given to people in 1798. So it's been around a while, and the understanding of how to administer it effectively is what's, I think, interesting and valuable. So there is a very famous German physician whose name was Manfred van Arden, who's primarily a researcher and not a clinician. And he actually started his life as a physicist, and he was sort of a student of Otto von Warburg, who was a very famous German physician, physicist who, physiologist who really helped discover, the energy production cycles of the body and the importance of oxygen. And these guys were thinking about this in the 1940s, 50s, and 60s, and they pretty much all were dead by the 70s, early 80s. So the idea is this, that as you age, there's an inevitable decline in the partial pressure of arterial oxygen. When you go into an emergency room, you measure the O2 saturation, which is done through the finger, and for it to really be abnormal, the partial pressure of oxygen has to be, let's say, less than, say, 65 or 60. So there, but when you're young and healthy, the partial pressure of arterial oxygen is, let's say, 95. And it holds that way until about your mid-50s, at which point you see in most people, not everyone, but many people, a gradual decline of about 5 to 10 millimeters per decade. So that many people by their 70s or 80s have a partial pressure of arterial oxygen by the time, let's say, they're in their mid to late 70s, in the area of 70 or so. And the point is that there is no biologic activity that isn't dependent upon an abundance of oxygen, because the primary production of energy is absolutely dependent on oxygen. You can go for a long time without eating and a fairly long time without drinking. And you can tolerate all types of nutritional deficiencies for extended periods of time, maybe even a lifetime. But you can't tolerate a lack of oxygen for more than a couple minutes. So oxygen is the premier, let's say, product that for our life. And so as it declines, there's a reduction in the production of the currency of energy, which is called adenosine triphosphate, and is made primarily, most efficiently, in the mitochondria. And each cell of our body has about, let's say, 10,000 mitochondria, which, interestingly, we inherit, the DNA of which we inherit entirely from our mothers, because by the time the sperm swam up to the egg, it used up all its energy and it was gone, and there was no more mitochondrial DNA to be part of the egg. So if you're tired, you could maybe blame it on your mother. But why not? You blame everything else on your mother, right? So the idea is there's this natural decline. And if you look at people as they age, there are many factors, of course, that cause the kind of characteristic changes. Just the effects of gravity on elastic tissue, causes us to have a reduction in size, and the effect of the oxidative stress of the sunlight accelerates our skin wrinkling. But from an internal point of view, the sheer abundance of energy and vitality almost inevitably declines for most people as we age, and it is definitely associated with this reduction in the partial pressure of oxygen. And then, if at any age there's an insult to the body, like an acute influenza, a surgical trauma, a severe acute toxic exposure, chemotherapy, radiation therapy, 4 different types of drugs that create drug reactions. You see this sharp transient decline that is associated with a sense of being washed out and feeling very ill. And in healthy people you see a gradual rise, but in people who are older and compromised, when they have that type of illness, they don't rebound as quickly, and they don't in part because the partial pressure of oxygen has gone down even more and doesn't recover quickly. In and above that, we also can measure the partial, and the way I'm measuring partial pressure of oxygen because in the hospital it's an arterial blood gas stick, which can be done and isn't that traumatic, but isn't pleasant, and you know is inappropriate for this outpatient setting in healthy people. So we have a very sophisticated piece of equipment that can measure partial pressure of oxygen in the transcutaneous tissue. So it's a little electrode that's applied to the skin of the stomach, usually, or some area like upper chest or stomach, could be leg. And it has a very subtle heating element that brings red cells to the surface, and then it has a transducer that can actually read the oxygen and partial pressure of oxygen and carbon dioxide level in arterial blood. And it's pretty accurate. It's used in pediatric ICUs, like with the preemies, not so much because you're looking for low oxygen, but when you're giving them oxygen, you would like it not to be so high because they can develop complications of excessive oxygen exposure. Or it's used in places where they're doing like skin flaps in complicated trauma patients, and they're looking for the adequacy of the arterial blood supply. And so that's how it's principally used in conventional medicine. So we measure the partial pressure of arterial oxygen. It takes about 15 minutes to do that of just lying still, and it doesn't hurt. But we also measure the partial pressure of venous oxygen. And the reason we measure the partial pressure of venous oxygen is, on the one hand, you want to know how well we are at delivering oxygen to the small capillary beds where it's used, how effectively we do that. But then you want to ask the question, well, how effective are the tissues in utilizing the oxygen delivered? So as an example, in a healthy person, the partial pressure of arterial oxygen might be, say, 95, and the partial pressure of venous oxygen, let's say, might be 35 to even 25, we see very often. And the difference between the arterial oxygen level and the venous oxygen level is very instructive. When it's 60 or greater, or even 50 or greater, people are pretty healthy. But people, as that end declines below 50, and certainly in the robust, healthy people below 60, but as it declines below 50, that's when people start to feel poorly. And you can make an inference if, as an example, a person is age 65 or 70 or 75, and you measure the partial pressure of arterial oxygen, and let's say it's 80, which isn't so bad, 80, 85, but you measure the venous oxygen level and it's 40 or 45, then that N is only about 40 or 45 to 50. And that person, again, is a person who really would benefit from oxygen step therapy. And there's a normative change with aging. And then when you, again, see in acutely ill people, you see the partial pressure of oxygen come down, and the partial pressure of arterial oxygen come down, and the partial pressure of venous oxygen go up. So the N, the difference, the amount of oxygen actually delivered to tissue, declines. And there's this explanation that's very elaborate by these physiologists that points to why.